Other areas that I would say are very, very important is just experience. And now when I say experience, I don't mean age. it's a situation is you can do the same thing for 50 years, and if you never want to change, you never want to try to get better, I just want to get good at doing this one thing this way. Well, then you'll be really good at doing that one thing one way. But materials continuously change. There's new solutions to problems and there's so many courses out there that as a dentist you're going to go out to courses. You're not sure which ones you want to take, and then you take some, and then you realize, okay, well, I should take this one here, but it doesn't fit my schedule. It's a real minefield in that respect, but you still have to push yourself. So now you say, I'm going to learn a new technique to do some sort of grafting, for example. Well, then, so you learn that, and it's going to take you a fair bit of time. Now you actually have to practice it a little bit, just even no patience, just depending upon what specific thing it is you're using, if it's lasers or grafts, or there's almost always going to be a time where you're going to have to sit around, come back to your office with your staff probably, practice some things, okay, how do we do this? And then you're probably, in many cases when you're incorporating a new technology, you're having to do things that you used to do this way quickly, but now this new way more slowly while you learn how to do the procedure. At the end of the day, you're going to do it faster and better, but you have to invest a bunch of time, and that takes patience. So when I say experience, it means experience combined with the desire to go out and continuously learn new things, and then realize what it takes to implement them. And because none of us are just inherently good at a brand new thing, and you're going to be slower at it. But one of my favorite things is, especially if I'm talking to new staff and about doing things, let's say, do it the very, very, very best way you can, the ideal way to do this procedure. Say we're talking about a filling. Yes, I know, but doing all of these things, it takes so long. And that's absolutely true. It takes so much longer to do it exactly according to this. But when you've done it 50, 100, 200 times in detail, exactly the way you should ideally be doing it, now it's fast. You can do it with your eyes closed. So what you're teaching yourself via experience is how to do things well and quickly. You can't do those, you just have to do it slowly to start off with. So that's why when I say experience, it's not just the age, it's how you actually approach your profession and your desires. Do you want to do it the very best you can? Are you willing to put the time in? And that's what I mean by experience, because it goes along with patience.